You know that visceral, terrifying moment when you see someone's skin suddenly turn blue? We all instinctively know it means something is terribly wrong, right? But what's actually happening under the hood? Physiologically speaking, it's the body's ultimate emergency alarm sounding off.
Welcome to This Explainer. Today we're putting on our medical detective hats to investigate the fascinating and honestly sometimes totally counterintuitive science behind this alarming symptom, which in the medical world we call cyanosis.
Here's how we're going to break this all down today. First, we'll look at the body's blue alarm itself. Second, we'll compare central versus peripheral cyanosis. Third, we'll dive into some high-yield clinical causes. And finally, number 4, diagnosing the root problem.
All right, let's jump straight into Section 1, the body's blue alarm.
So, the strict clinical definition of cyanosis is a bluish discoloration of the skin and mucosa. But here's the kicker. Turning blue isn't just about some generic lack of oxygen. It's highly specific. It's caused by an accumulation of deoxygenated or reduced hemoglobin circulating in your blood, or occasionally by abnormal pigments like methemoglobin.
And this is exactly where the math becomes absolutely crucial. Think of your hemoglobin molecules like a fleet of microscopic delivery trucks driving oxygen to your tissues. The cyanosis alarm only triggers when you have an absolute concentration of more than 5 grams per deciliter of completely empty trucks driving around in your system. If you don't hit that exact 5-gram threshold of deoxygenated hemoglobin, you simply don't turn blue. Which brings us to a massive plot twist. We call this the anemia paradox. Picture a patient with severe anemia, someone whose total hemoglobin is already incredibly low, let's say less than 5 grams per deciliter total. Because their entire fleet of delivery trucks is so tiny, they physically can't accumulate 5 grams of empty trucks. That means a severely anemic patient can be critically starved of oxygen, literally hypoxic, without ever turning blue. Their alarm system is completely masked. Crazy, right? Moving right along to Section 2, central versus peripheral cyanosis. To solve this case, we have to look at the geographical map of the body. If you see a blue tongue and blue lips, you are dealing with central cyanosis. That's a massive red flag pointing to a systemic issue, like heart or lung failure, causing arterial desaturation everywhere. On the flip side, if the lips are perfectly pink, but you see isolated blue hands and feet, well, that's peripheral cyanosis. That usually means localized blood vessel constriction, maybe from the cold or a local blockage, while the body's central engine is still oxygenating blood just fine. Now, when that central blue alarm is blaring on the lips and tongue, the culprits are generally pretty serious. The major causes fall into 2 main buckets, cardiac and respiratory. On the heart side, you're looking at things like left ventricular failure, or structural defects like tetralogy of Fallot and veno-arterial shunts, where deoxygenated blood is just completely bypassing the lungs. Then on the respiratory side, it could be a sudden pneumothorax, or chronic blockages like severe COPD, asthma, or interstitial lung disease.
Okay, let's dive into Section 3, high-yield clinical causes.
Let's look at some specific scenarios, starting with acrocyanosis. This is when you get a bluish color localized just to the hands, feet, and maybe the area right around the mouth. The crucial detail with acrocyanosis is that the internal mucous membranes, like the inside of the mouth, stay completely, safely pink. This tells us the core oxygenation is totally fine, and we're just seeing a largely benign, localized vessel response to something like a drop in temperature. Then we have a very specific, super dynamic type of acrocyanosis called Raynaud's phenomenon. This follows a highly memorable 3-step color shift that's usually triggered by the cold or even emotional stress. First, the fingers turn stark white due to a sudden vasospasm cutting off the blood flow. Second, they turn blue as the trapped hemoglobin drops its remaining oxygen. And finally, they turn a fiery red as the vessels open back up and blood comes rushing back in, a phase we call reperfusion. Raynaud's is a fantastic clinical clue. Sometimes it's primary, meaning it just happens on its own without any sinister underlying cause. But actually, we always have to be vigilant because it frequently acts as secondary Raynaud's, which is a subtle early warning sign for underlying autoimmune and connective tissue diseases, most notably systemic lupus erythematosus and scleroderma. Before we leave our clinical gallery, we absolutely have to talk about polycythemia. This condition literally flips the anemia paradox completely upside down. Polycythemia means the body has an unusually high mass of red blood cells. Because their fleet of delivery trucks is massively expanded, it takes far less of an oxygen drop for them to hit that absolute threshold of 5 grams per deciliter of empty trucks, meaning they trigger the blue alarm much faster than a normal person. Finally, Section 4, diagnosing the root problem.
So how do doctors investigate the root cause without just guessing? We pull out the diagnostic toolkit. We use ECGs and echocardiograms to check the electrical and structural integrity of the heart, ruling out any of those cardiac shunts. We use chest X-rays and pulmonary function tests to clear the lungs. We grab a pulse oximeter for SpO2 and draw an arterial blood gas to see exactly how much oxygen is dissolved in the blood. And hey, if all the heart and lung hardware looks totally fine, but the patient is still blue, that's when we measure methemoglobin levels directly, searching for that rare chemical deficit that alters the hemoglobin itself.
Well, that wraps up our investigation. We've tracked this blue alarm all the way from that simple 5-gram threshold of empty hemoglobin through the geography of central and peripheral clues, straight to the final diagnostic tests. The next time you step out into the freezing cold and notice your fingertips changing color, ask yourself, what incredible invisible alarms are silently protecting your body right now? Thanks so much for joining me on this explainer, and keep questioning the fascinating science happening just beneath your skin.